how long do I need to be in the hospital in order to have acute care covered by Medicare?
How long do you have to be in the hospital to have it covered? Well, if you go in the first day in the hospital,
is it 4 days?
You're going to be there. Oh, 3 days, not counting day of discharge.
Okay. 3 days plus day of discharge. So I'm just going to say 4. I
would say 4 too, because it's too confusing if you don't. Because hospitals start their day at midnight.
Okay.
So
if I'm in there at 4 days, what does that qualify me for?
That would trigger the ability to go into the nursing home under Medicare days.
So and how many days do we have of acute care and rehab under Medicare? 20?
Well, the first 20 days is when you're going in. When you're in your 20 days, after you've been discharged from the hospital.
I'm trying to get
Where are you at, though?
The 20-day, I'm on the 5th day, and I'm going into an acute nursing care.
Okay, you've been discharged from the hospital after your 5th day. Then you're going into the skilled nursing rehab situation.
And so I've got 20 days here, correct?
And you've got 20 days. For the first 20 days, it's paid at 100% by Medicare.
And then about the 18th day, what do I usually hear?
Oh, you've plateaued is what you'll hear. You've plateaued, but you don't really plateau. But that point is where they're trying to get you transitioned into probably a nursing home, because they know they get 100% payment for the first 20 days. And after that, I think it's a billing issue and time costs. But you are actually allowed another 80 days under Medicare rules, because the Medicare will pay all of the benefits except for $1,132, which is what you would have to pay a co-payment.
So it's like about $150 a day that you would have to pay in addition. I'm using
if you're in the hospital, right?
No, we're in the rehab acute care facility. Nobody stays in the hospital any longer.
But they should know that they are allowed to be able to be there for the first 60 days.
So what do? So let's say I have a 92-year-old woman who just had hip surgery. How many days was she in the hospital?
2.
2.
Yeah. Well, I would have appealed for the 1 day.
But she was doing okay. But I mean, I didn't have it, and she went immediately to the acute care. She was under an HMO, so the requirement wasn't that she had to be in there for 4 days.
And it can be different.
Yeah.
It can be different. That's the problem.
Understand the HMO rules and the Medicare rules are somewhat different.
Yeah, and that's why you have to know what your HMO rule is, because there are too many that are different. They have the same guidelines to use as Medicare.
Everybody in the industry, in the hospital industry, knows these rules like the back of their hand. The only persons who don't know the rules is you all. The patient, exactly. And so you need to have somewhat understanding of these rules, so whomever is caring for you understands when they say, hey, you have plateaued, what they're basically saying, hey, we want you out of here. Okay? And then you say, your agent says back to them, it says, I don't believe he or she has received their highest level of functioning. In other words, with more therapy, they will get better. The problem is, what is rehab? Is rehab walking down the aisle 20 steps with a therapist technician and 20 steps back? You better ask what rehab means. There's some really good facilities and doctors and nurses, and there's some really lousy, lazy ones out there as well. Okay?
You need to talk to your doctor.
Yes.
You need to really be communicating with the doctor, because they are the one that writes the prescription for your care. One
other thing, because this is kind of new as well. Does your family physician, when you go into the hospital, Carole Ann, are they in charge of your care?
When you're in the hospital, you have a hospitalist doctor. Your hospitalist doctor can communicate with your primary care doctor, but the one in control is the hospital's doctor.
Right.
Now, I have a hard time with that because how does that gentleman or lady have the knowledge of your total history?
And each floor has a different hospitalist.
Yes.
Yeah.
Yeah.
Yes. Yeah.
And
And,
it's very
some of them are
difficult.
good, and some of them are bad, and some of them have, who are they paid by? The hospital. Okay? Hospitals get paid on your particular disease or calamity. What are you diagnosed when you go in there? And the government, whether you're on Medicare, most of us will be on Medicare, they pay the hospital that specific dollar amount.
And most insurance companies are using the same guidelines as Medicare.
Right. And so if they get you out in 2 days, where normally 4, they make a little bit more money. On the other hand, if they have to keep you in there for 10 days and they're only going to get paid for 5, they have to take the 5 days. Hospitals are in a horrible situation, you know, economically. One of the best things about this presentation is the green sheet. I'm so happy you did this. The green sheet. It says Lumetra. What is Lumetra?
Lumetra is the organization you will call when you have denial of medical services or if you think you're being discharged from the hospital or nursing home too soon.
And what does Lumetra do?
It's okay to cry.
What does Lumetra do?
Lumetra is going to evaluate your case, talk to the doctor or the hospital and to you, and determine whether or not you require further care in that particular setting.
But just the fact of calling Lumetra gives you another 24 hours.
It's going to stop the system until Lumetra has made a decision.
If you're still in.
No, if you called them, they won't discharge you.
They will not
shouldn't.
discharge you.
That's what I mean.
Yeah. Oh.
But if
I believe in your case, this is after the fact, and you wanted to know.
Yeah. You
no,
want
if you
to.
call that number, everything
that,
stops.
Yeah. You want to make that call. Yeah. You want to make that call in the hospital.
You don't want to go home and call.
That's good information.
Yeah. Yeah. And again, the person who needs to know this is your agent. Okay? For your advanced health care directive. They need to understand this. Most situations, of course, every floor has what's called a discharge nurse as well. And their only job is to get you placed into a nursing care facility. But the hospitalist has to control whether or not you stay in that hospital. And you have to have good conversations with them. If you don't feel like you're ready to move, you know, then your agent can talk to the doctor and then call the Metro. Yes. One of the things that other on the sheet for resources is the Council on Aging. What is the program that Council on Aging program runs?
HICAP. Health Insurance Counseling and Advocacy Program. It's a wonderful organization. It's been around probably since 1990 here in Orange County. And the staff there are trained.
The number
Julie
right
Shane is the director. No, Cheryl Maroke is the director. And Julie is their staff attorney.
HICAP will help you with long-term care insurance. We're going through Medicare.
Oh, like a consultant.
Yeah, and they're all volunteers.
Yeah.
And there's no charge.
There's no charge. But they are an organization that's been around since 1990. And they have trained staff. Their director is Cheryl Maroke. Julie Shane is their staff attorney. And they help with even real serious problems like the gentleman that had disability. If they had some issues, they would help assist with that. They help with Medicare. When prescription drug plans come about, you're trying to make those decisions, they help with that.
Put the green sheet with your documents, please, so that your agent can get a hold of it. Because the rules and the laws are going to change. Who knows what they're going to be 5 years from now. But these are the folks who will have that information at the time. Or you can call Carole Ann. Let's see. Let's go to...
And don't forget, for the 21st or the 100th day, if there's a co-payment of $141.50 in the nursing home.
What is
That is-
I'm going to go back to page 2 under insurance.
Okay.
What is a California partnership policy?
Okay. California partnership policy is a policy that you would want to consider if you're going to buy long-term care insurance. And why would I say that? Because it has automatic inflation in the policy, a deductible that only has to be met once in a lifetime, has care coordinated assistance in securing your plan and services, has waiver of premium.
What does that mean?
A waiver of premium is if you're using the policy, you don't have to pay the premium.
So this is not a policy you pay 1 year in advance?
No, I'd never pay a policy a whole year in advance. I'd go on
Okay.
a monthly basis because you're likely not to get a refund.
Yes.
And the policy can be coordinated to fit your particular needs.
And what does it mean? Let's say if I buy a $300,000 policy.
And why it's a good policy is because if your policy pays out $300,000, you then have $300,000 of protected assets that you could have in the bank and then still qualify for Medi-Cal long-term care services.
What they're trying to do with the California partnership is to get less people on Medi-Cal. And it's one of the best policies out there because it has the partnership of the state of California involved. And so the state of California wants to encourage people to have a long-term care policy. Is there any requirement, is the Genworth policy that you got a California long-term?
I think it is, Pete.
Okay. You may want to check. This is the one you want to get. Not every insurance agent can sell a California partnership. What do they have to do?
Have 8 hours extra training. And the company...
They have to go to a continuing education program for 8 hours in order to sell the California partnership.
Right.
Most agents will not put that time in.
Now,
so they may not offer it to you.
Right. Some of these companies can't stop selling temporarily, but the ones that sell this policy is Genworth, John Hancock, and I think John Hancock's on hold, but check with your agent. Bankers Life, Metropolitan, and New York Life are the only ones that were licensed for long-term care.
Bankers Life and what else?
New York Life.
New York?
New York Life, MetLife, Bankers Life, John Hancock, and Genworth.
Okay, and Met. Okay. I like Genworth the best.
It seems to be the most popular.
Yeah, and the reason why I like Genworth the best is because they seem to be the most stable. They have the most, they have the best balance sheet. Okay? Not because they have the nicest people. They might have, but we don't know.
But whatever the policy pays out is going to protect that dollar amount in your assets.
If you have a long-term care policy and it says we'll never increase your premiums, can an insurance company still increase your premiums?
The only time an insurance company will be allowed to increase premiums is if they've gone to the insurance board, the Department of Insurance, and the Department of Insurance has said, okay, for this block of business, you're allowed to increase $20 premium per month. But they have to have it approved. They can't just go in and send you a bill and say, this is increased, this is increased. They can't do that. They have to go by regulations and go through the Department of Insurance.
But most of the Department of Insurance is going to grant the increase because they don't want the insurance company to go out of business.
Well, and the cost of care is going up too.
So let's take a look at page 3. We talked a little bit about the Medicare days. Are there any questions on those Medicare days? On page 3 at the top of the page? Okay, comprehensive policy. Is there a difference between residential home care? Doesn't one policy cover everything, Carole?
A comprehensive policy is going to, but if it's limited, it's not going to. Maybe you'll buy a policy that'll just cover skilled nursing and maybe residential, but not all of them are going to do that because you're going to pay more premium. Okay,
so one of the things is to take a look at your policy, and if you don't understand it, then get together with one of the high-cap volunteers who come here to the center and say, hey, what kind of policy do I have? Do I have residential care? Do I have home care? Huh?
What's different?
Residential care is
think of residential care, assisted living.
Where you have 5 people in a home and that kind of a thing. Home care, of course, is to bring in the caregiver.
And
adult daycare, you know, we know what that is, I hope.
Adult daycare, you're going to go to the facility and spend a few hours there a day.
Respite care, a lot of people don't, that's a wonderful benefit if you have it in your policy. You know, it's because of the idea that the person who's caring needs a break.
Yeah.
Right, Andrea?
You're the spouse of a sick individual. You want respite care benefit to trigger to have a caregiver come in and they get paid.
Okay.
Give you a break. Go away and take a rest.
From my point of view, you try to get a California partnership policy first. Don't even look at anything else.
Mine too.
But if you can't get a California partnership, then look other places. It's just the fact that, let's say, for instance, if you've had cancer or if you had heart disease, it does not eliminate you from coverage. It may exclude that coverage for a period of years or months, right? But it may come back in. Yeah, so don't.
And you do want to disclose any of your medical conditions, because if you disclose it, then they can't deny if you didn't. Because if you deny and you don't tell the truth, at the time of need, they're going to say, too bad, we found out for the medical records that you didn't disclose.
The last thing you want to do is lie on that application.
Yeah,
you
they'll
just don't
refund
want to do
your
it.
premiums probably, but you're not going to get any coverage when you need it, and then you won't be able to buy it either.
A good agent is going to go through with you these factors that are on the bottom. What's your deductible period? How much per day? Is there a cost of living? Is this catastrophic? Remember, we don't stay in the hospital very long. So in the statistics, you know, includes, when they say 60% of all people need long-term care, well, that's, you know, I mean, we're talking about from people who are 20 years old all the way up to 100. Because we do not stay in hospitals for long-term, for the ADLs. But as soon as we get better, then we go home. Okay? So don't believe a lot of the statistics that you hear from the insurance company. But a good agent is going to work with you and with these factors. What ifs. Do a lot of what ifs with your insurance agent.
One of the things you want to do, a lot of times you hear about these life care contracts, you go and you put in all this money and you're going to have care in this facility. You're going to need to look at those contracts very carefully because they're not licensed by the Department of Insurance. Their authorities come from the Department of Social Services and to get a certificate, but they may not have a certificate. If they don't have a certificate from the Department of Social Services, they should go under the long-term care chapter of insurance. But you need to know whether they do or not. And you also want to know how are these transitions of level of care going to actually work, because sometimes it isn't like it's supposed to be. You want to be sure you understand how that contract is. The other thing is, if sometimes you're not even going to, depending on the payment system, you're not even going to be able to qualify for Medi-Cal. So you've got to look at that kind of a contract very carefully.
Did you say that certificate or what?
Certificate from a Department of Social Services.
Thank you.
Okay. What's also happening in the insurance area today is long-term care policies are not being sold a lot. Because one, those people who have wealth are not buying the policy. Those people who are on the lower income side or the lower net worth are not buying the policy. So the market is squeezed. Not only that, long-term care policies is fairly new. It's only been around for about the last 20, 30 years. So other insurance has been around hundreds of years. So what they've come up with is hybrid policies. And they'll try to sell you a universal life insurance policy with a small component in it for long-term care. Basically, you get your money back that you put in, that you can use to pay your caregiver, etc. Variable annuities are being sold now with a long-term care portion in it. My recommendation is to stay away from it.
Mine too, because if you're going to ever get in a position that you do need long-term Medi-Cal, these are going to be a problem to you, big time.
They try to do too many things in one policy, trying to disguise it. It's kind of like if you drink coffee, let's put a bunch of cream and sugar in it to hide the coffee. You know, it's still in there, but these are what these things are, and they have enormous commissions involved. Okay, so try to stay away. Your Way booklet.
Thank you, Pete. Yeah. Your Way is a booklet you want to call and get. You can get 2 copies for free at 310-533.
It's on your
1996, and it is on the referral sheet. And why do you want this? Well, Pete wants you to get a bottle of good wine and sit down at the table with your family and discuss the questions about life, death, and pain management, organ and tissue donations, and what kind of setting do you want to do and how do you want to be treated if you don't have the ability to recognize and communicate with people, and what matters most to you. You want to get this booklet and go over it and fill it out once you get it. Don't just put it on the desk and then it goes in the drawer and it's hidden forever.
Take a bottle of wine, sit down with that Your Way booklet with whomever is going to be your agent and talk. Talk about what does that person mean? What does hospice mean? Andrea, in your quest, what does hospice mean to a 40-year-old?
To a 40-year-old?
Who does never heard, just heard casually about hospice.
Nothing to a 40-year-old.
Yeah.
Unless they've been diagnosed with a terminal.
Yeah. Well, what I hear is it's just, okay, the person's dead or is going to be die.
Yeah.
That's what they think. Okay, we've got hospice, we give up.
And that's not the meaning of hospice.
Yeah, it isn't.
And most HMOs will have a hospice program. It's some of them are carved out, but and they may say they don't pay for hospice, but Medicare would kick in because it was a carve out of that Medicare contract.
Do you have to die in a hospital?
No.
No. You can die at home if you like.
That's the idea, stay at home.
Do people eat before they die?
Absolutely.
Mm-hmm.
All the way up till death?
If they can, if they want to.
Depends,
Yeah, it depends on the
people
condition.
shut down. The system shuts down.
Yeah, there's usually this.
You know? Do you want a stomach plug? Raise your hand. A stomach plug. You know, if you can't eat food through the mouth, do you want a plug in your stomach to be fed?
Yeah, let them know in your way book.
Yeah. Write it down. How about hydration? Nothing.
That's all I want.
Morphine. Do you want more morphine or do you want less morphine?
I'm with you.
What if I said to you, if I give you more morphine, you may die quicker?
That'd be fine.
But your agent needs to know this stuff, and you guys need to have that conversation, okay?
Come to dinner with me, we'll have it.
Yeah, invite her to dinner, okay? Morphine, we've got comfort care. How about where are you going to be buried? Is that an issue in families?
Yes.
Huge. Some people want funeral. Some people want, you know, I want to express my love. I got to spend at least $20,000 because I want my family to know how much I love. Do you want a cardboard box? You know, $35. You want to be cremated?
Make it in your garage.
Have the conversations. I used to think all these issues was for the dying person. And it isn't. It's for the other people who are alive. They may need a funeral or a service. They may need to have closure. You know, so please discuss it. Anyway, the last part of the program, I want to take a couple of minutes and no more than that. That help, by the way, that Your Way booklet is absolutely wonderful. Please get it. Do you have to be totally impoverished in order to be on Medi-Cal?
No, you do not.
Okay, let's give us a 3-minute version.
Quick. Okay, 3-minute version is that the Medi-Cal regulations are there to keep the spouse from being impoverished. Means to start off, we have exempt assets, means I don't have to count towards the eligibility. And that includes the home, as long as I intend the person that wants Medi-Cal intends to return home. And
Is there a limit on the value of the home, Carole?
Currently not yet, but eventually there will be
You're looking at
$750,000 limit, but it's going to be probably based upon the tax assessment.
Can you have a Lamborghini, or does it make any?
You can have a Lamborghini, you can have all your jewelry, all your personal effects. Only one Lamborghini though, no other cars.
Okay.
$1,500 in life insurance, so forget all that life insurance we've been talking about. Prepaid burial plan of unlimited dollar amount. Doesn't matter. Gold casket, white doves, but be sure you have it in the contract. Don't decide after death that the loved one wanted this and that. Get it ahead of time in a contract. The person in the nursing home, if you're single, unfortunately can only have $2,000 in assets. If you're a married couple, you can have $109,560. If you have an annuity, we have to fix the position of the annuity. If you have IRS, KEOs, or deferred compensation, they will all be exempt. The nursing home person will have to have a minimum distribution from the IRA, KEO, or
the point is,
plan.
You can have all these assets and still qualify for Medi-Cal.
And maybe reposition them to qualify.
Right. And there's no such a thing as a Medi-Cal bed. Okay? There's no such a thing.
Yeah. A bed is a bed is a bed.
That's a marketing term. Yes. There's so many myths out there on Medi-Cal.
Why are you liquidating your assets?
Yeah, you.
So I can qualify for Medi-Cal.
Well, you're doing it the wrong way.
Yeah.
I can guarantee that.
The program is there to assist people that need it.
That's what I
do. And this is not a program how to get. There's a 9 out of 10 people out there who quote unquote give Medi-Cal advice are there quote unquote to try to get you qualified and earn a fee. They charge $5,000 to $10,000, and half of them don't know what they're doing. Avoid them like the plague. Okay?
Except for me.
Except for you. But
I go by the rules.
yes, and the rules allow someone to own assets and to do it properly and still qualify.
Yeah.
And
you don't want to try to cheat, because they will come back and get you for fraud.
And they should.
Because I've.
So what's the 36 months?
The 36 months is that if you're going to do gifting, and sometimes when you're doing planning, for example,
I would go up to 5 years on that now, Pete.
oh, 5 years?
Better.
Okay.
For safety factor. I mean, 36 now, but I'm looking at 5 in the future.
For example, you run into by the way, there's plenty of room in the inn. There are facilities like the Wellington, Sunrise, all these corporate kind of places that they have, and they hire 2 to 3 people just to market their services. And there is plenty of room here in Orange County for care facilities. And they will just as soon take a Medi-Cal patient as not. But what they want to do is they want to fill the place with private pay first.
You want to be careful on that gifting issue, because Deficit Reduction Act, DRA, is going to come into play somewhere in the future. It was signed into law by President Bush in 2006. And it's there. It's just, when is the state of California going to take the time to train their staff to be able to implement DRA? And the gifting can be an issue, because if it does what it's supposed to do, it's going to start that penalty period for the value of that gift at the time you make an application. So you're going to have to be very careful on how you gift.
But sometimes
they don't always do what they say. But I'm just giving you a warning so you don't get the wrong impression here.
Yeah, you want to play with these numbers, with the rules, and also with private insurance, with the family. This long-term care area is a huge issue. And by the way, dining is a huge business. This guy's morbid. But it's big business. And I mean, it's just huge. And so that's why the more you guys talk about it, communicate about it, get it out in the open, and that way more people understand what's going on. Unless you want to donate your body for UCI, for medical research, you can do that.
How do you do that?
Huh? You set up now privately, you contact UCI, tell them you want to donate your body, you'll sign a special form, and they'll give you all that paperwork.
If you...
But see, the thing of it is that I used to think that we'd do a workshop called It's Your Death, but I didn't think anybody would come. Anyway, Carole Ann did a terrific job.